Now moving on to other stories. The managers of Asutifi North District Health Directorate in Ahafo region say mental health cases among the youth is on the increase. They are therefore calling on the District Assembly to assist them with necessary drugs to treat patients. Speaking to Adum News on the matter, the District Chief Executive of Asutifi North, Anthony Mensah, revealed that their information indicates the youth who are involved in galamsey activities are taking illicit drugs, and that has led to the increase in cases. Joining us on Zoom now is Dr. E.A. Azuzong, who is a psychiatrist at the Accra Psychiatry Hospital. Doc, first of all, what is the situation like at your facility? Are you also recording increases in young people coming to your facility with mental health issues?
The use of, yes, we have been currently recording an increase in mental health cases among the youth, particularly the adolescents, people who are like 13 years and below.
Have we been able to identify what is causing this?
Yes, so there are a myriad of reasons why a lot of young people would come to the psychiatric hospital. And in our case, for instance, we do have a lot of them who are coming with issues with depression and anxiety. And then substance use among them is also on the rise. And the substances we notice they use mostly are cannabis. And then although you have a lot of them using cannabis, cannabis is considered the gateway to other substances. So a lot of people would start with cannabis and then move on to alcohol, to nicotine, and then to the very rare ones like cocaine and heroin. And then some also use amphetamine and hallucinogens as well.
How alarming is the increase?
Yeah, so if you ask how alarming is the increase, so according to, we do not have enough data in Ghana, but as at 2000, it was estimated that you have like about 5 out of 10 youths and adolescents who have mental health issues. And it's been shown that substance use is very, very common among them, especially those in the senior high schools. And but the worldwide data, according to WHO, says that 20% of adolescents have mental health issues. But then they do not categorically specify whether it is substance use or it is depression. But then 20% of adolescents would record mental health conditions.
Okay. Doc, kindly hold the line for me and let me bring in the DC for the Asutifi North District Assembly, Anthony Mensah, who joins us on phone. Thank you so much for joining us. How worrying is this situation in your district?
Serious viewers. Yes, we had a report from the Health Directorate about the increasing rate of mental illness within the district. And the link, it has to do with the illegal activities of mining that is going around this area. And so what it means is that some of the youth, those that are interested in doing such acts, go about over there and then hide themselves over there and then use the opportunity to enter themselves, engage themselves into such acts. And so it is increasing a lot. And so what we have done as an assembly, especially DISEC, is that we try to fix out those people to be able to deal with them, and also those people that sell them to those boys. That is what my district police commander and then plus my good self and then the entire DISEC is trying to do, to be able to bring it down.
Once you've been able to identify that it has to do with galamsey, and galamsey is something that we are trying to overcome, what specifically have you done in that regard as well? Ending the source where they are able to abuse substances.
Yes, what we are doing to bring that menace down is that we have taken a decision to call the chiefs and people of this community, especially the key stakeholders, and then we give to them the information that we have about what is happening at those areas. And then putting them together, all of us will come on board to be able to get them.
Well, Honorable, but if we're talking about Galamsey, these are legal sites, aren't they? Are they legally recognized sites that they are mining at?
They are not legally recognized. And DISEX has taken a decision to go and then drive all of them away and then get those perpetrators, those that are into selling those drugs to those boys.
Well, how long has this been happening, the mining activity that is getting them to abuse substances?
It is just recently that we had the data from the Health Directorate that this is linked to those people that are interested in doing illegal mining.
Okay. Now, the Health Directorate is asking for funding to deal with the issue. What is the plan of the Assembly in that regard?
Yes, the plan is that we trying very well. It's like something that we keep doing frequently, making sure that if there is something that comes out from the Health Directorate, the Assembly doesn't sit down, we just quickly go into it. So this one, it is not something that we are going to leave it. We are just going straight to it to deal with that, to be able to minimize the situation.
Okay. I'm grateful that you could join us. That's the DC for the Asutifi North District Assembly. Then let me return to the Accra Psychiatry. And Doc, so with what you've told us, with what the DC of Asutifi North has told us, how can that, or how does that reflect on the national incidence?
Yeah, so on the national scale, when psychiatrists meet, depending on the number of OPD cases and the various rehab centers we have across the country, it's also been shown and it's reflecting that there is quite an increase in especially drug use and substance abuse among the youth. And although we do not have data to show, there are quite a few cross-sectional studies that have been done across the countries. And like I said earlier, it's been shown that among senior high school students and university students, it is actually on the high.
All right. Doc, I'm grateful to you that you could join us. You're still watching the Joy News Prime. We'll take a quick break. We'll be back with more stories. Stay with us.